there is a hidden cost when it comes to being unhealthy. Recently, the Ghana Medical Association lost a doctor in one of the second largest hospital in Ghana, a Confanoche Hospital. And my condolences to the doctor and his family and everyone. When the news came, it came as a shock, and I've read multiple news articles, and everybody seems to be blaming it on one thing, that it's because of the poor healthcare system. And some of the articles have headlined how the healthcare system has failed its own doctor. But then I for one hold a contrary opinion to some of these ideas that has been spread, because I know the vast population keep talking about that. But even the procedure that was talked about, because he died from a heart attack, so myocardial infarction. And I bet you, if you sat in a medicine class, probably internal medicine or whatever, the presenting sign of MI, myocardial infarction, is death. Nobody survives it. If you are lucky and you survive, fine, but ask any doctor. The first presenting sign of myocardial infarction is death. So if he suffered from a myocardial infarction and he's dead, that is a presenting sign. Now, I'm not saying that it is not sad news. It's a sad news, because he, as a physician, was an emergency physician. And I think there are two ways we need to look at this situation. And I want to pick the two ways of looking at this situation. One, I want to look at what led to that. Let's look at the root cause. Let's stop talking about everything, the root cause. And then whilst I discuss about the root cause, we talk about all the procedures people were talking about, the catheter stuff and all these things that everybody keeps talking about, spreading about the fact that he needed a procedure and the procedure couldn't be done in Confanoche, so they had to bring him to Accra, and that led to his demise. That is very unfortunate and it's very sad. I sympathize with his family, I sympathize with his loved ones, everybody. But then there's another side which we'll discuss about when it comes to the whole medical system setup that we have in the nation currently. So the first point I want to talk about is that his role was being emergency physician. It means that this individual was probably not sleeping. He was working on call 24/7, which means he was delivering services to other sick patients. Now, being an emergency physician means that it comes with a lot of responsibilities. You have to wake up. Your sleep is always disturbed, probably. You don't get to rest. You are moving up and down. Probably he's doing other locum services at other facilities to complement what he does. And I'm going to say this. Doctors are not compensated highly enough. Regardless of whatever everybody thinks, we are not. Because if you look at the patient to physician ratio, trust me, it's not good at all. It's not nice. So it means that doctors have to work more to even earn a better, decent living, which means he's going out there, not sleeping, running around, constantly working. And people don't know what sleep does. If you lack sleep, if you don't sleep well, sleep deprivation leads to a lot of problems. And I will tell you, because there was poor sleep or constant sleep deprivation, that led to poor eating habits, so many other factors, which then will lead to him having multiple issues with his system, which means that there will be clotting issues, there will be block, there will be hypertension, there will be diabetes, there will be multiple things. And these are things that even the doctors are treating, but they are also suffering from it because life is different. And being a physician doesn't mean that you know how to be healthy. It's healing or treating. Disease management is not the same thing as being healthy, because being healthy has nothing to do with medicine. It's about how do you live on a day-to-day basis, your day-to-day lifestyle that actually promotes good health, and then you live well and you are rid of disease. You don't have any issues. So all these things coupled together led to his stress. And I'm telling you, prevention is better than treatment. Healthcare is expensive. So people talking about the catheter, all those things, it takes an expert to actually do that procedure. And think about it, even when you come to Accra, I think it's only 3 places we have that services. I think Kolebu, Uracare or something, that there was, I think there's the last one. And think about the expertise. We don't even have the expertise in the first place to even handle, even if we have the catheter lab, we don't even have the expertise in the first place. Now, have anybody considered the financial cost that service actually renders on the patient and their family? Everybody keeps talking about provision being made for such services, but have people thought about the cost? Because we don't have Medicare in Ghana, or we don't have Medicare here. We don't have our national health insurance is not so highly incentivized to the point that it can address some of these things. It's still our NHIS is still covering for malaria medications and stuff. It's not even up to, we are not even up to that point of covering for stuff. Even common chemo, it's not even covering it to a certain extent. And I'm telling you this because I have a first-hand experience with someone, with my mom having cancer. So I know what I'm telling you. I've seen it firsthand. So we don't even have systems that can cover. And even the private health insurance even don't cover to a certain extent. So it's not just about we making noise about service provision. Are we thinking about the burden that those service provision is going to cost to bring? Are people ready? Because our economy is not so strong that we can even talk about all these other aspects of services that we want to include. So if we as a citizens don't start looking at how we can prevent issues, then trust me, we are in a very, very, very bad place. We are in a sinking ship, because if we start having multiple issues like this and we are not getting the necessary support, and we are going to have that, we are not getting, how many people are going to survive from it? Because even this procedure we are talking about, how many people even have the money? And do you have the money to raise the moment your patient falls down and has a heart attack? Do you know when a patient is actually going to suffer from a heart attack? You don't. This is a situation nobody knows when it's going to happen. So my advice is that we need to start looking at prevention, because prevention is cheaper than treatment. Health is expensive. And if anybody tells you that health is cheap, then he's lying. So those out there not sleeping, drinking, smoking, doing all these things, you are in for a joyride. Even common dialysis, people can't even pay for it. So please, let's tread on the prevention road rather than trying to treat, because the treatment is not easy. It's expensive. Prevention is cheap. And in his case, please, doctors also need help. Doctors also need support, structures. Because in his case, if you are practicing something like sleep deprivation, something that actually supports sleep deprivation is creatine. A lot of people don't know. But creatine, you think it's only for bodybuilders. It's actually for people, anybody. Any human being needs it. And for somebody who actually doesn't sleep, if you want to mitigate the sleep deprivation effect on your body, you actually supplement with creatine, you are going to see the difference. The same thing when it comes to vitamin D, omega-3s, they are very good. If you're having heart issues, you can supplement with that. Omega-3s are very good. It can help you. It actually helps to thin the blood. Instead of going for aspirin, you can do omega-3s. So doctors also need structures. In as much as they are helping patients and all that, they also need structures to also help them. Because if you get somebody who can design structures for you, it also helps to support your own health. Because now the hidden cost here is this: he's gone. Think about all the dependents on him who now have lost their breadwinner. Now he dying at 47 years. He's too young. Now he's gone. Look at the number of people who were depending on him: a family, children, wife, other people, people in society who were looking up to him. They've lost their breadwinner. So if you're out there and you're struggling, it's not only about making money, but it's about taking good care of yourself. It's about putting structures in place to support your health. That is what you have to do. And those are the things we need to look into. So please, let's stop making noise about all the things that needs to be done and what provision, health system, and like, make yourself a priority and take care of your health. Your health is your wealth and is in your hands. So please, let's take good care of ourselves. Let's eat right. Let's sleep well. Let's avoid using drugs and all those things. Let's avoid all those things and take good care of ourselves. And as always, I'll see you tomorrow with exciting surprises.